Dr. Mentz's facial rejuvenation. Dr. Mentz's facelift philosophy is simple. Mentz facelifts must look natural. Patients say others never know they've had work done. Most importantly, the scars are undetectable.
I've heard it's even hard sometimes for you to see your own incisions later after plastic surgery.
Yeah, I'd like for my incisions to be completely invisible. And I do my best to get there.
Dr. Mentz is highly recognized for his innovations in facial rejuvenation techniques. With 3 board certifications and more than 50 presentations and papers on facial plastic surgery, Dr. Mentz is an authority on facelifts. He even wrote the chapter on advanced facelift techniques for this major medical textbook. This high-energy businesswoman came to Dr. Mentz because she felt like she was the oldest woman at the board table. Look at the Mentz transformation. The improvements in her eyes, cheeks, and neck are remarkable.
She looks beautiful and 20 years younger.
Yeah, she's done beautifully, and she has excelled in her business as well as in her social life.
How did you achieve such a change in her eyes, though?
We did have to remove some of the fat in the lower lids, tighten some of the skin in the lower lids, and remove some skin in the upper lids as well. We also changed the contour in her eyes just slightly to give her a more almond shape to her eyes.
And those little details make a big difference. That's why patients say Mentz facelifts are in a league of their own. You met Janet Hurd earlier. Now let's learn about her facelift.
This is a good example of a patient who looks very good, but is just beginning to show some signs of age that do require facelifting for improvement. The changes that you see with aging are drooping brows, and you can see she's got kind of a mean look to the eyes, flatness in the cheeks, jowling and a square look to the jawline, and some neck looseness. You can see the corner of the mouth is turned down.
Dr. Mentz did an endoscopic brow lift. He lifted her cheeks, repositioning the soft tissue on her cheekbone. He lifted her jowls and the corners of her mouth and did a neck lift. You can see the dramatic change. She doesn't look tightened, she looks natural.
Her result is a more youthful and elegant appearance. Her eyes are more open and sexy. Her cheeks are better positioned and more youthful. The corners of her mouth are lifted just slightly, and the neck contour is beautifully elegant.
Dr. Mentz, she looks fabulous.
She does look great, and you can see that she wears her hair back, and the scars with her facelift cannot be seen.
And look closely at her side profile. Her new neck alone makes her look so much more youthful.
This is also a good example of what can be achieved in patients who are just beginning to show substantial aging. Many patients say, when do I come in for my facelift? I think the best time to come in is when you're just beginning to show some age.
Janet was 48 years old here, but many patients come to Dr. Mentz in their 30s and 40s. Dr. Mentz offers endoscopic procedures that leave no scars and offer the younger patient beautiful results. This patient is a perfect example. She's in her mid-30s.
You can see her brows looked a little severe. They were low and were angled like she was angry. Her cheeks had just begun to flatten. She had some shrinkage in the upper lip and balance problem there. She looked as though she was pouting.
Look at what Dr. Mentz accomplished, all through endoscopic procedures. That means no major incisions and a quick recovery for the patient.
We've performed an endoscopic brow lift and endoscopic cheek lift. We've added some fat over the cheekbone. We've added some fat in the upper lip, and we've made her nose a little bit smaller to give her a more youthful appearance.
So natural, but so powerful.
She looks great.
With the brow especially, he does it endoscopically, meaning very teeny tiny incisions. So not even the hairdresser will be able to tell that they've had a brow lift.
You're kidding.
It's beautiful, it's amazing.
This patient had a full facelift and neck lift. Look at the striking improvement. Dr. Mentz even reversed the effects gravity had on the edges of her mouth, yet she looks perfectly natural. Dr. Mentz says this patient wanted to recapture her old self.
Our strategy was to give her back her youth by elevating the brows just slightly by opening the eyes just a little bit, by elevating the cheek fat, by adding some fat around the mouth, and by lifting the jowl and tightening the neck. We also performed a rhinoplasty to straighten out her nose and give her a more youthful looking nose as well. And so in her after pictures, she has a much brighter look to her eyes, a much more youthful looking cheek, and softness around the mouth.
You can tell she feels like a completely different woman.
She does, and you can see it on the street. Her self-esteem and her sense of pride have changed.
And look at her profile. Dr. Mentz made her look so much more youthful.
With age, the nose has a tendency to drop and you tend to lose fullness in the mouth. And it gives you sort of a witchy kind of old look. And what we've done on her profile is given her a little bit more elevated nasal tip and given her a little bit more fullness around the mouth. Not big lips, but just softness in the mouth.
Dr. Mentz is known for his expertise at noses, since he is also an otolaryngologist. Dr. Mentz says a surgeon has more than 500 different options on a nose job, so he gives great care to giving you just the right fix.
Having a nose that's beautiful and elegant and strong and that is in harmony with the rest of their features is a great thing. It can move a patient from looking average to looking beautiful and elegant.
Dr. Mentz transformed this woman's nose, giving her a much more elegant look. Another surgeon had done this patient's nose, but it just wasn't right. Dr. Mentz operated and gave her a much more elegant nose, slimming it perfectly. He also elevated her brows slightly to open her eyes, and he did fat grafting to her cheeks to add back youthfulness. Again, Dr. Mentz used endoscopic procedures to rejuvenate this younger patient's face.
Those minor changes really make a big difference though when you look at her face. So much more pleasant.
They're very subtle, but the nice thing is these are changes that patients can do in their 30s and 40s that do not require a scar.